Hi all, Tim Case here with AMR Maltco PSEP, bringing you a short presentation on heat-related illnesses just in time for the hot weather we have here in Portland. So we're going to talk about a few different things today, most specifically heat cramps, heat exhaustion, and heat stroke. We're going to talk a little bit about dehydration as well. And you're going to hear things like hyperthermia, which is more of the umbrella term for the heat-related illnesses. Hyperthermia, as you can guess, is just elevated body temperature above normal, and usually classified above the 104 degrees Fahrenheit or 40 degrees Celsius mark. Again, it's the umbrella term covering heat cramps, heat exhaustion, heat stroke. And it generally occurs when the intrinsic heat regulation system is overwhelmed by the body. So the primary player in control of body temperature is the hypothalamus. Some people call it the master thermostat. There's different functions of the hypothalamus, but what we're going to focus on today is its control of thermoregulation or body temperature, thirst, heart rate, and vasodilatation. And the way the hypothalamus creates its effects is it secretes releasing hormones that will then go have effect on the pituitary gland, which will release its hormones. They will migrate down to the end target organs and create their effect, whether it's positive or negative feedback. Today we're going to focus on the cooling aspect of things. So if you can think of the vasculature in this instance kind of as a radiator system where the warm blood from the central core is driving up that core temperature. The afferent sensors in the periphery, even in the core and the abdomen, the great vessels, they sense that there's too much heat in the blood, so it's going to cause some vasodilatation and push that blood out towards the arms, the legs, just to try and cool it off, get it closer to the skin. It's going to create some venous pooling. Hopefully that the convection effect of proximity of cooler air to warmer blood helps pull some of the heat out. Your body's also going to start to sweat. So the evaporation of the sweat into the environment hopefully is going to cool your skin so that, again, heat from your vasculature will be pulled out and dissipate into the environment. So not much of a problem here in the Portland area with humidity, but the sweating effect and cooling really only works to a certain point in relative humidity, and that's somewhere in the neighborhood of 85% relative humidity. Anything above that, your sweat's really not going to evaporate just because the ambient air is already overly saturated with moisture. So that's a little bit of the physiology we're looking at here. Some pathophysiology. Our body, thermolysis is a term of just heat dissipation. Your body's trying to get rid of heat. So like I mentioned earlier, vasodilatation and perspiration are going to be some primary means of doing that. Again, creating that venous pooling, hoping for some convection, some evaporation of the sweat, cool that blood down. So some signs and symptoms you may see: diaphoresis, unusual sweating for the environment, increased skin temperature. You may have hot, red, flushed skin, maybe hot, red, and dry, depending on what severity of heat-related illness you have. Also some altered level of consciousness, as well as things progress from basic dehydration through heat cramps, exhaustion, and stroke. So there's predisposing factors that really set our patients up for succumbing to the heat. As body temperatures rise, like I mentioned, the afferent central and peripheral temperature regulating sensors do their best to get to the blood, to the periphery, and attempt to cool you down. But things that are going to affect that is the age of the patient. As the patient's age, their ability to thermoregulate decreases. They have impaired blood flow to the skin. They have ineffective sweat glands. maybe on some medications, which we'll talk about in a little bit, that really affect that as well. So other patient demographics in terms of age would be infants with their larger body mass to skin surface ratio. They have an underdeveloped autonomic nervous system. They can't really regulate their own temperature very well, so they actually rely on us as adults to help them stay cool or stay warm. So the very old and the very young have harder times cooling intrinsically. Overall health status is a key component to trying to stay cool as well. Obviously, those in good health have an easier time because their bodies are operating with efficiency. There's no other comorbidity that is going to affect the transmission or secretion of hormones from the hypothalamus or the pituitary gland. There's not going to be any kind of issues with vasodilatation, things like that. Also, patients with respiratory disease, COPD, CHF, they're going to have a hard time with the heat, especially the CHF patients in high humidity situations. Poor body habitus, so the morbidly obese don't cope well with high temperatures. And any other kind of heart, lung, or kidney disease that causes any kind of generalized weakness or inability to really move about or find cooler environments because they're already weak. Certain medications, like I mentioned earlier, can really affect a patient's ability to thermoregulate. Medications that affect heart rate or smooth muscle control play a significant role in this. So diuretics, sedatives, tranquilizers, kind of classic example of beta blockers, they're not going to allow much vasoreactivity just based on the mechanisms of action of those medications. So then additionally, things to consider are their ability to access cool environments. So those with lower socioeconomic status, elderly, children that don't have the ability to be in a cool environment, they just can't cool down. So they're stuck in that hot environment. So think the patient with decreased mobility is going to be trapped inside their house that, maybe the windows are closed because they can't open them, and it's 108 degrees outside and it's pushing 95 to 100 degrees inside. They just can't escape the heat. So let's talk a little bit about dehydration. So your body uses fluid, whether it's to help digest food, whether it's to humidify the air that we breathe. When we sweat, we lose fluid. So what's a big killer for us is the insensible loss of fluid. So that's going to be breathing enough dry air. Our body's going to attempt to humidify that so that the moist mucosa of our lungs aren't dried out by the 15, 16, 17% relative humidity air that we're breathing. That's 108 degrees. And then we're going to sweat. And the more you sweat and the more that it evaporates, that's more fluid loss from your body. So dehydration also causes a breakdown in the methods of thermolysis, and it inhibits perspiration and vasodilatation, again, because that fluid loss. Even if you do have some vasodilatation, you're already operating at a deficit. So, most importantly for dehydration, just recognizing the signs and symptoms. Do a set of orthostatic vital signs. Are they having any kind of increased thirst, dizziness? Is their skin dry? That might be a late stage sign. Otherwise, if they're still sweating, that's good, but they really need to increase that fluid intake. So also noting the urine output. Are they going to the bathroom once a day when they usually go 3 or 4 times? When they do, is it a real dark concentrated yellow color? Those are all indicators of some dehydration. And then just the skin tenting or the skin turgor. When you pinch their skin, does it stay up? Indicating that there's some fluid loss. So once we get into the dehydration, that's pretty easy to fix. Just kind of IV fluids, take their vital signs, check where they are. Are they a little tachycardic, a little hypotensive, let's give them 500, 1,000 of fluid, see where that leads us. But the key for them is to hydrate early and often, and unfortunately, alcohol does not count. So once we've suffered through a little bit of dehydration, say we're still outside working out, going for our daily run at the hottest part of the day, we have a job, much like ours, that requires us to work outside, where we overly exert ourselves. We start finding ourselves getting into some heat cramps. So on that spectrum of heat-related illnesses, heat cramps is kind of at the low end. And that's usually, it's associated with some dehydration. It's caused by overexertion of muscle groups during physical activity in high temperature environments. And it affects, usually you're going to see those effects in the muscle groups that are being stressed. So you're going to see some involuntary and intermittent spasms in larger muscles. If you're out for that afternoon jog, you're using your quads a lot, your calves, you're going to feel some cramping there. If you have a manual labor job, some upper body muscle groups may be beginning to cramp, biceps, etc. And you really need to start pushing the fluids at that point. So the cramps, again, they're involuntary. They can be pretty painful if you don't work them out. But really, of all things, heat cramps are also pretty easy to take care of. So really the primary treatment is going to be to defer the workouts or strenuous activities to cooler times of the day if you can. That's kind of your first line of defense. But if those things are unavoidable, stay hydrated. If we encounter them on the street, let's give them some IV fluids, get them back up to good levels. Start cooling them off. Just put them in the back of the ambulance, turn the AC on, let them cool down, and they can stretch the muscles that are cramping. They can do a massage, all those things. So by and large, all things considered, pretty easy to take care of.
Now the problem is if they don't note those warning signs, they keep working out, they're not drinking, they may start finding themselves into a little bit of heat exhaustion, and that's kind of the next step in the heat-related illness spectrum. HRI is heat-related illness. So it's a little more severe than heat cramps, but obviously less so than heat stroke. You're going to have patients that you're going to find that either have poor hydration or nutrition. They lack cooling measures, so they can't get into their house and cool down. They don't have a shady spot to sit under a tree to cool down based on the type of work they do. And they're just starting to dump a lot of electrolytes, lots of sodium in the sweat. They have that insensible loss through breathing the hot air, being in a hot environment, sweating, etc. So some of those intrinsic cooling measures are becoming overwhelmed. They're not failing yet, but they're pretty stressed. So some signs and symptoms that we're going to see are increased core temp greater than 100 degrees Fahrenheit. They may be confused or a little altered, but probably going to have a normal mentation. They're going to be diaphoretic. They could have cold, clammy skin, but they're probably going to be pretty sweaty. Weak, rapid pulse, some weakness and fatigue, maybe a headache, tell you that their head's throbbing. So when we encounter those guys, let's get them into the back of the ambulance, take them out of the environment. If they're wearing some heavier clothing, let's try and get some of that off. If they're wearing a jacket, or if they're working outside in a long sleeve shirt, taking that shirt off. If they have any tight, constricting clothing on, let's take that off. Let's have their skin be able to connect with some cool air, again for that convection process of thermolysis. And then we're going to kind of do our standard package of IV O2 monitor, make sure that they don't have any kind of electrolyte issues that are affecting their cardiac rhythm, if a little bit of oxygen if they need it, and IV. So we can do the IV access per protocol. We can give up to 2 liters of chilled saline, and you can also attempt to cool the skin. So a little mister bottle with tepid water on the skin, as long as there's good airflow for convection and for evaporation
is always a good thing. So if you are going to wet some towels to put on them across their chest, on the back of their neck, on their forehead, make sure there's steady airflow across those towels. So just wetting towels and putting them on their body with no airflow has the likelihood of actually increasing their temperature rather than decreasing their temperature. So that should be avoided, obviously. We don't want to make them hotter, we want to make them cooler. So, and then let's get transporting to the hospital if that's where they want to go. So we shouldn't delay transport if it's needed to start cooling. If they're kind of in the beginning stages of heat exhaustion and they just want to cool down a little bit, get a liter of saline in there. So getting into heat stroke, that's the most severe heat-related illness, and this has the potential for really bad outcomes, including death. So generally, when a patient has reached heat stroke, their hypothalamus has failed. Damage has occurred to that anterior nuclei that we talked about that controls thermoregulation, resulting in just unregulated hyperthermia. So any intrinsic effort that your body is going to make to try and cool itself down just begins to stop. And eventually cell degradation and death begins to occur. So temperatures exceeding 104 degrees Fahrenheit or 40 degrees Celsius with supporting history, and if they're in the appropriate environment, superheated environment, kind of like the 108 degrees that's predicted for today, that's a bit of the hallmark of heat stroke. So some signs and symptoms you're going to see, they can have hot, dry skin. If the cause of the heat exposure is high ambient temperatures, probably going to see that hot, dry skin. But if it's more an exertional issue, they may have moist skin just because they're still trying to attempt to cool themselves through sweating. Obviously, the elevated core temperature is a sign or symptom. And then changes in mentation. Patients could be confused, agitated, altered. They could begin having seizures, and they can be unresponsive depending on how long they've been in the environment, how severe the heat stroke is. We could find them completely unresponsive. So respiratory could be rapid and shallow, some tachycardia. So our treatment, again, is going to be a lot along the same lines as the heat exhaustion, just more aggressive. So we're going to get them out of that environment, into the back of the ambulance, turn the AC on, start cooling them down, remove the excess clothing, allow cool air to blow across their skin for any kind of evaporation or convection. Again, IVO2 monitor, maintaining their airway for them if they can't do it themselves, depending on how altered they are. And then the cooling measures, again, wetting the skin with good airflow, the little Mr. bottle, IV access with chilled saline, cold packs to the groin and to the axillae, all good things to do. So the one thing that we do want to be cautious of or cognizant of, remember, is that we're going to cool this patient, but we don't want to cool them so fast that we cause any kind of drop in pressure to put them into hypothermia and then have that rebound shivering, and they try to create their own body heat through shivering, and then we have that rebound hyperthermia again because our cooling measures were too effective. So really a target for us in cooling is about 102 Fahrenheit or 39 Celsius. And really the goal is to reduce temperature by 0.2 Celsius per minute, again down to that 39 C or 102 temperature. So here you see a little graph of kind of the different things. So conditions: heat cramps, heat exhaustion, stroke, and then just across the top, the mental status, respiration, what you're going to see in each one of those things. So here in Multnomah County, they have some cooling centers. You can find them at the website that you see below. There's also these 3 county-sponsored cooling centers that you see listed here. There may be others that I don't have listed that are through churches and other organizations, but you should at least look into these places to refer people to
just if you encounter anybody at post or see some people having a hard time with the heat, let them know that these cooling centers are available. So here's a little 5-day outlook for us here in Portland. Today 108, tomorrow 109, and then we have a nice little cool down to 99. Never thought I would say 99 was a cool down, but there you have it. So hopefully that has some good information for you guys. If you have any questions, please feel free to let me know. Until then, be safe.